State Transport Department on high alert. Transport corporations alerted due to Covid-19 scare. Health Department officials to meet MDs of KSRTC and BMTC. The Health Department officials to hold talks with Transport Department. In fact, Sriramulu, the Health Minister, is talking live. Let's get across.
ಅಲ್ಲ ರಕ್ತ ಪರೀಕ್ಷೆಯನ್ನು ಮಾಡಿಸಿ ಯಾರು ಕೂಡ ಆತಂಕ ಭಯಪಡಲಿರೋದಂತ ನಾವು ನೋಡ್ಕೊಂತೀವಿ. ಈ ಕೊರೋನಾ ವೈರಸ್ ಬಗ್ಗೆ ಯಾವ ರೀತಿಯಲ್ಲಿ ಕಳೆದ 6 ತಿಂಗಳ ಹಿಂದಗಡೆ ಪ್ರಾರಂಭವಾದಂಥ ಜನವರಿಯಲ್ಲಿ ಪ್ರಾರಂಭವಾದಂಥ ಈ ಕೊರೋನಾ ವೈರಸ್ ಬಗ್ಗೆ ನಾನು ಇದಕ್ಕಿಂತ ಮುಂಚೆ ಕೂಡ ಪ್ರಿಕಾಷನರಿ ಮೆಜರ್ಸ್ ತಗೊಂಡಿದ್ದೀನಿ. ಕರಾವಳಿ ಪ್ರದೇಶಗಳಲ್ಲಿ, ಬಂದರ್ ಪ್ರದೇಶಗಳಲ್ಲಿ ಮತ್ತು ಏರ್ಪೋರ್ಟಲ್ಲಿ ಕೂಡ ಸಾಕಷ್ಟು ಜನರು ರಕ್ತ ಪರೀಕ್ಷೆಯನ್ನು ಮಾಡೋದ್ರ ಮೂಲಕ ಎಲ್ಲ ರೀತಿಯಲ್ಲೂ ಕೂಡ ಆ ಕೊರೋನಾ ವೈರಸ್ಸನ್ನು ಸಂಪೂರ್ಣವಾದಂಥ ಪ್ರಿಕಾಷನರಿ ತಗೊಂಡು ಹತೋಟಿಯಲ್ಲಿ ನಾವು ಇಟ್ಕೊಂಡಿದ್ವಿ. ಯಾಕಂದರೆ ಇದರ ಬಗ್ಗೆ ಮಾಹಿತಿ ಬಂದಂಥ ಟೈಮಲ್ಲಿ ನಮಗೆ ಕೂಡ ಆತಂಕ ಇರೋಂಥ ಟೈಮಲ್ಲಿ ಯಾವ ರೀತಿಯಲ್ಲಿ ಪ್ರಿಕಾಷನರಿ ಮೇಜರ್ಸ್ ತೊಗೊಳ್ಬೇಕು ಅನ್ನೋಂಥ ಸಂದರ್ಭದಲ್ಲಿ ಸುಮಾರಲ್ಲಿ ಬೇರೆ ಬೇರೆ ದೇಶಗಳಿಂದ ಬಂದಂಥ ಪ್ರವಾಸಿಗರನ್ನ ಸುಮಾರಾಗಿ 300 ಜನರನ್ನ ರಕ್ತ ಪರೀಕ್ಷೆ ಮಾಡಲಾಗಿತ್ತು. ಆ ರಕ್ತ ಪರೀಕ್ಷೆ ಮಾಡಿದಂಥ ಟೈಮಲ್ಲಿ ನಮಗೆಲ್ಲ ಕೂಡ ಮಾಹಿತಿ ಪ್ರಕಾರ ನೆಗೆಟಿವ್ ಕೂಡ ಬಂದಿದೆ. ನಂತರ ದಿನಗಳಲ್ಲಿ ಈ ಕೇರಳದಿಂದ ವಾಹನಗಳಲ್ಲಿ ಬಂದಂಥವ್ರನ್ನ ಕೂಡ ಆಲ್ರೆಡಿ ಬಸ್ಸುಗಳಲ್ಲಿ, ಕಾರುಗಳಲ್ಲಿ ಬರುವಂಥವ್ರು ಕೂಡ ಆಲ್ರೆಡಿ ತಪಾಸಣೆಯನ್ನು ಮಾಡಿ ಅವರೆಲ್ಲರೂ ಕೂಡ ಏನೇನು ಪ್ರಿಕಾಷನರಿ ಮೇಜರ್ ತಗೊಳ್ಳೋಂಥ ಕೆಲಸ ಮಾಡಿದ್ದೀನಿ. ಇಡೀ ರಾಜ್ಯದಲ್ಲಿ ಪ್ರೈವೇಟ್ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಮತ್ತು ಗೌರ್ಮೆಂಟ್ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಕೂಡ 10 ಬೆಡ್ಡು ಈ ಕೊರೋನಾ ವೈರಸ್ ಬಗ್ಗೆ ಕೂಡ ಅವರಿಗೋಸ್ಕರವಾಗಿ ರಿಸರ್ವ್ ಕೂಡ ಮಾಡಿದ್ದಿದೆ.
That was Health Minister Sriramulu stating that there is absolutely no need to panic as the situation is under control. The government is taking every possible measure to make sure that the virus does not spread. Talking about the Transport Department here, now State Transport Department is also on high alert. The transport corporations have been alerted due to the Covid-19 scare. Health Department officials will be meeting MDs of KSRTC and BMTC. Health Department officials will hold talks with the Transport Department. BMTC and KSRTC personnel have been instructed to wear masks as precautionary measure.
ಸುಮಾರಲ್ಲಿ ಬೇರೆ ಬೇರೆ ದೇಶಗಳಿಂದ ಬಂದಂಥ ಪ್ರವಾಸಿಗರನ್ನ ಸುಮಾರಾಗಿ 300 ಜನರನ್ನ ರಕ್ತ ಪರೀಕ್ಷೆ ಮಾಡಲಾಗಿತ್ತು.
The epicenter is China, but the deadly virus has spread across the globe. Over 3,000 people have already lost their lives due to the deadly Covid-19. Although China tried its best to contain the virus, but it could not be contained. The recent deaths have been reported from US. 6 people have lost their lives due to coronavirus. What's new, you may wonder? Well, much to the shock of everyone, the virus seems to have spread in Karnataka as well. Over 200 suspected cases of coronavirus have been reported in the state. Their Health Minister Sriramulu now giving a word of assurance to everyone, stating that there is absolutely no need to panic as the situation is under control. My colleague Suraj Suresh joins us live from newsroom with more inputs on it. Well, Suraj, what exactly are we looking at when it comes to the virus in Karnataka? Break down the situation for us.
If you have to understand the entire pandemic here, the epidemic which is seen across of the world, now there are close to 90,000 odd cases which have been confirmed at this point in time, and over 3,000 cases have been reported positive. Let's just take you through as to how the world map looks like at this point in time with respect to coronavirus here. This is a live tracking website which we have found here. It's called the infographics.news Asia. So clearly here we see there are several dots in particular. These huge red dots indicate that this is where the highest number of deaths have been reported, and the orange which you're seeing here, each of these orange spots which you're seeing in all of these regions, these are where the positive cases have been confirmed. So let's just take a look now, particularly in Asia, because Asia is where most number of cases have been reported. If we zoom in That is when we find the confirmed cases which are there, how many confirmed cases are there, how many reported deaths are there in each of these countries. So coming to China, 80,151 confirmed cases, 2,943 deaths which have been reported here. Hong Kong, 100 confirmed cases, 2 deaths reported. Macau, 10 confirmed cases. Taiwan, 41 confirmed cases. Vietnam, 16. Thailand, 43 confirmed, 1 death. Cambodia is 1 confirmed, Malaysia 29 confirmed cases, Singapore 108 confirmed cases, Indonesia 2 confirmed cases. So these are the numbers which they give, and especially we should remember the Diamond Princess cruise ship as well, where 706 confirmed cases. This is in Yokohama, where it has been stationed for weeks together now. Even Indians were present here. Their blood samples were also taken. They were tested for coronavirus. It has come out negative. But here we see 706 confirmed cases, 6 deaths have been reported on the Diamond Princess. So this is very important, which we have to see. Now, apart from that, if we have to come to India, that is where our focus will be. India here, if we have to go ahead and see here, India 5 confirmed cases at this point in time, and in Nepal there is 1 confirmed case, in Sri Lanka there is 1 confirmed case. India 5 confirmed cases because 3 in Kerala and 2 which have been reported at this point in time. That is 1 from Telangana and 1 from Delhi. So that is where we are seeing India at this point in time, 5 confirmed cases, even though they have gone ahead and they have said that in Kerala they have been treated, they have been cured, but still, it remains, the entire count is being taken at this point in time as to how many cases were confirmed or confirmed. In Pakistan, 5 confirmed cases is what is seen. In Nepal, it is 1 confirmed case. So this is what we are seeing. Neighboring countries as well is what they are keeping a track on, because the triangular countries, the neighboring countries which are present here, we have to keep a close watch on them as well, because it is susceptible that people might travel all the way from Sri Lanka, from Pakistan, Nepal. So this might cause a lot of problem here. So that can be another cause of concern. Now, with respect to Dubai as well, because it is said the person who was traveling all the way from Dubai, he had come down to India, especially Bengaluru. He stayed here for 3 days here. So that is why it is possible that they can travel all the way from the Saudi Arabia region, the Dubai region, then they can travel all the way to India, and in particular Bengaluru region as well. That is why they're keeping a close watch on how many confirmed cases are present here, how many people have are susceptible to this particular coronavirus or COVID-19, and whether or not they are traveling to Bengaluru. So that is why at Kempegowda International Airport as well, they are keeping a close watch on who are the people who are coming in, which country are they coming from, and if at all they're coming from areas like China, Hong Kong, Dubai, or even Thailand for that matter. All those areas, if they're traveling all the way till Bengaluru, they will be quarantined. They will be going ahead and checking whether or not they have contracted coronavirus, and then they will be under home quarantine for close to 28 days. That is the kind of period which they're considering at this point in time. So here, this is the main region where they will be going ahead and they will be keeping a close watch on, because Saudi Arabia as well, there is there are several cases which have been reported at this point in time, and here we see from Kuwait 56 confirmed cases are there, Bahrain 49 confirmed cases, United Arab Emirates 21 confirmed cases, Qatar 3, Oman 6, Saudi Arabia 1 confirmed case, Iran 1,501 confirmed cases and 66 people have been reported dead, and Iraq 21 confirmed cases. So a lot of people travel to Saudi Arabia constantly from India, so that's why they will be keeping a check on these areas as well. But if we have to go ahead and see what is the condition like in other continents here, in North America, United States in particular, 91 confirmed cases are there, and 6 have been reported. 6 deaths have been reported. In Canada, 27 confirmed cases are seen. So that is with respect to what is there. Mexico, 5 confirmed cases. and in Ecuador, when we come to South America, Ecuador 6 confirmed cases, in Brazil 2 confirmed cases. A lot of people travel even to North America, for that matter, in particular United States and Canada, because a lot of people go there for studies as well. So that is why even these 2 areas, they are keeping a close watch on whether there are students who are traveling all the way to India, and in particular Bengaluru, if they have gone for their masters, and if there are possibilities that their university or their region there was coronavirus which was reported, the cases were reported, then they will have to quarantine those people as well. So this is the scenario at this point in time. This is a live tracker which everyone can use. They can go ahead and see how many cases have been reported at this point in time. In India, for that matter, now 5 confirmed cases, 3 in Kerala, and 1 from Delhi and 1 from Telangana. Here it is said that a Bengaluru techie in particular, he had traveled all the way from Dubai. He had come to Bengaluru, stayed here for 3 days, took a bus and went all the way to Telangana. The passengers who were present in the bus, they are also quarantined at this point in time. 28 days is the quarantine period where they will be checking for other symptoms as well, and if at all they start responding, if they start recuperating, and then it is well and good. So until then they will have to remain under home quarantine. So we'll have to see what more reports come in, whether or not there were several people, because it is said that he stayed in Bengaluru for 3 days. So were there anyone else who have contracted this particular coronavirus, and will they have to be quarantined or not? That is something which the health department is looking at, in particular the health minister as well, Sriramulu. He is speaking to all of the officials, even the commissioner Pankaj Kumar Pandey. He is also present at the spot, trying to gather all the reports possible. So at this point in time, the procedure is ready. They are equipped to handle any of the coronavirus cases in Bengaluru, but more details are expected from the health department in just a short while from now.
Right, Suraj, do stay with us. We have some more big news coming in. Kempegowda International Airport staff and personnel wear masks as precautionary measure. Airport staff instructed to wear masks. Staff aboard planes too instructed to wear masks. Big news coming in at this point of time. Kempegowda International Airport staff and personnel wear masks as precautionary measure. The airport staff has been instructed, as well as staff aboard planes too has been instructed to wear masks. But there also has been a high alert issued at Kempegowda International Airport due to COVID-19. Let's quickly go back to my colleague Suraj, who joins us from the newsroom. Well, Suraj, we have a situation here now. The Kempegowda International Airport already has been kept on high alert. Health and Family Welfare Department also is on high alert. Now, the million-dollar question here is that is the state ready to deal with the outbreak? Are we equipped enough?
Well, from what the Rajiv Gandhi Institute of Health Sciences, what they have said is that they are equipped. They have beds which they have already prepared. Even the health department has said that all of the other precautionary measures have been taken. Task force is present at in all of the districts in Karnataka, because task force will have the they will have the doctors, they will have the pathologists, and they will have the other equipped doctors as well, who will be going ahead, knowledgeable doctors who will know as to how to combat or how to ensure that the home quarantine can be made. So there will be special tents as well which will be set up. At this point in time, the health department says that they were anticipating if at all there are possibilities that, because once it comes to Kerala and in particular the Kasaragod region or the Wayanad region, there are possibilities that it might come all the way till Kodagu region and those old Mysuru region as well. So that is something which they were anticipating, or they were keeping a close watch on. That is why a task force was sent in to especially the coastal regions like Dakshin Kannada, and they had also sent to Mangaluru as well. So these regions, there are task force which have been stationed, and in Kodagu and Mysuru region as well, there is a task force which has been stationed for immediate response. So yes, the health department at this point in time, they have said that we are quite equipped and we know what coronavirus is. We have reports coming in from China and we know how to go ahead and cure, because they have several tablets which they are trying out, which is used usually for the dengue cases, or which are used for other viral infections or viral diseases for that matter. So they will try to use that, and in particular in China as well, there are few of these combinations which they have tried and which has actually worked out, and the victims who were there to coronavirus, they have been recuperating at this point in time. So they will try to use those combinations as well and try to cure anyone who has shown the signs of coronavirus here, have been tested for coronavirus. So it is very important at this point in time. They have also tested the tissues, they have tested for which are the genes which will be manipulated, and they have also gone ahead and checked where the coronavirus is trying to affect which parts of the body, and they are trying to take the samples from there. They are trying to test and ensure that there will be an antibody for this particular antigen. So that is why at this point in time the health department says that they know which kind of antigen is trying to react on which particular gene or which particular tissue of the body. So they are trying to have that particular combination of medicine which will be present so that they can combat these viruses. What exactly happens is, when a virus is given, vaccination is the only way to avoid any of these diseases in the near future, because somewhere vaccines will have the dead viruses or the antigens which will be present. Then the body will start producing antibody on themselves. So that is why at this point in time they're trying to find the vaccine so that others can be ready to combat, or the body can be ready to combat this particular virus here. That is why the health department trying out different methods, various procedures as well, trying to get in inputs from China and other universities across of the world so that they can also be ready for combating the entire virus here, Neha. So even the Kempegowda International Airport, there are doctors, there are pathologists who are present there. They will be taking blood samples, they will be testing it. They are keeping a close watch as to who's coming from which part of the world, and if at all there are many cases which have been reported in the section where they are coming from, then they will be tested for coronavirus. So that is the kind of procedure which the Kempegowda International Airport or the authorities at the Kempegowda International Airport are trying to bring in at this point in time. So yes, until now, luckily no one in Bengaluru have been tested for coronavirus. No one's been tested positive for coronavirus. But with the recent case coming to light, who has traveled all the way from Bengaluru to Telangana and he's been tested positive there, that is a cause of concern. That is why the health department is on its toes. The health minister has already arrived. He is going to be having a live conference with all the DCs, with all of the other authorities as well from across of Karnataka, and he will be having the Commissioner for Health and Family Welfare Department. He will be having the director. He will be having the deputy director as well, who is handling the entire coronavirus aspect, that is Prakash, Dr. Prakash. So he will also be present in the meeting. They will be going ahead, they will be discussing with the health minister as well as to how they can go forward and combat this virus, Neha.
Do stay with us, Suraj. We have some more big news coming in. BJP MLAs discuss about COVID-19. State cabinet ministers ask CM to take immediate action. Chief Minister B S Yediyurappa apprised of the situation. CM B S Yediyurappa also holds talks with cabinet ministers. This is the big news coming in. BJP MLAs are also discussing about COVID-19. State cabinet ministers have asked the Chief Minister to take immediate action. Chief Minister B S Yediyurappa has been briefed about the situation. At this point of time, the situation seems to be quite worrisome, even though Sri Sriramulu, the health minister, has assured the people of Karnataka that there is nothing to worry about. BJP MLAs also are now discussing about COVID-19. The Chief Minister also has been briefed about the situation. We have some more big news coming in. Chief Minister B S Yediyurappa summons Health Minister Sri Sriramulu. Sri Sriramulu has briefed Chief Minister B S Yediyurappa over COVID-19 scare. Sri Sriramulu briefs Chief Minister over the steps taken to tackle COVID-19. Well, here now, Chief Minister has summoned Health Minister Sri Sriramulu, and Sri Sriramulu also has briefed the Chief Minister over the steps taken to tackle COVID-19. The Health Minister is also expected to hold a presser shortly. The epicenter is China, but the deadly virus has spread across of the globe, claiming over 3,000 lives. In Karnataka, over 200 suspected cases of coronavirus have been reported.
So, idishtu
Health Minister just a little while ago, while talking to the media, stated that there is absolutely nothing to worry about. The situation is under control. The state government is taking enough precautionary measures to tackle the situation. Coronavirus so far has claimed over 3,000 lives.